finalize our recommendations to OHA and the governor's office.
After nearly a month of meetings, Oregon's COVID-19 vaccine committee made a choice.
We're prioritizing hundreds of thousands of people, which far outstrips the supply of vaccine.
Members must submit recommendations to Governor Brown by Sunday, the 31st, about who's next after healthcare workers, educators, and seniors. Thursday, they voted on this list, which recommends prioritizing several groups all at once: people under 65 with underlying conditions, frontline workers, yet to be defined, people in custody, and those in low-income and congregate senior housing. These groups total more than 1 million Oregonians, but overlap would mean it's actually fewer people. Up next would be multi-generational homes, then the general public. The advisory committee has spent weeks reviewing Oregon Health Authority and national data with the goal of addressing inequities for BIPOC, Black, Indigenous, people of color. Many of those communities are disproportionately impacted by COVID, with more cases and deaths per capita.
In terms of the potential legal challenge, do we use BIPOC or not, or a different word?
We're not able to prioritize services or make decisions based on services solely on somebody's race or ethnicity.
In the end, the committee did not include race specifically as a guidance for priority, instead designating vulnerable groups that overlap with BIPOC communities.
Not by virtue of their race alone.
Some on the committee disagreed about not specifically designating people of color.
Our system is not yet prepared to center on and reveal the truth of structural racism and how it plays out.
It's unfortunate we have to play these games because of the legal issues.
Let's just agree that everybody's needs for our community and our people are not going to be met.
They did agree on one thing.
It's just so hard, very, very challenging.
That implementing this list will take months. OHA warned of consequences for having such wide vaccine eligibility without having doses readily available.
Ultimately, we don't want to frustrate communities. Think, I'm eligible right now and know that there's not enough slots.
The list moves forward to the governor's office, where she'll have the final say, with the committee set to meet again next week to discuss implementation strategies to reach these communities. Galen Etlin, KGW News.